All set.
Well, good morning and welcome to our February Group Insurance Commissioners meeting. It is February, although it does feel somewhat spring-like. Don't be fooled. We are in the Boston area and there's plenty more winter to go around, but it's a beautiful day. So thank you for joining us, those who are on live stream and our commissioners. So we have a very exciting meeting today. I am joined by my commissioners. We have Vice Chair Bobby Kaplan. We have designee Catherine Hornby for A&F, and welcome, Catherine. It's been quite a while, but we're happy to see you. We have designee Rebecca Butler for the Division of Insurance. We have Commissioner Elizabeth Shabbat, Commissioner Adam Chapdelaine, Commissioner Toby Choate, Commissioner Christy Kleinard. We have Commissioner Tamara Davis. We have Commissioner Jane Edmonds. We have Commissioners Joe Gentile. We have Commissioner Eileen McEnany, Commissioner Melissa Rodriguez, Commissioner Sinenko, and Commissioner Tim Sullivan. Did Commissioner Grzino Garad join us yet? He may be joining late, and at this point, I want to welcome all of us to this meeting. So Matt, why don't you go ahead and review the agenda, and we'll look forward to hearing about today's exciting meeting.
Great. Thank you, Madam Chair. Thank you, members of the Commission and the public for joining. We are excited to present to you today our plan design for a final vote, our plan design changes for fiscal year 24. Before we do that, Emily Williams, our Chief of Staff, will provide a report out of the annual member information sessions that we held last month. Really excited to present to you the results of that. We had, once again, tremendous participation from our members, and there's still plenty more work to go engaging with our members before annual enrollment. So those are the two main items. We also have a report from our CFO, Jim Rust, as we typically do. And that is the agenda for today.
Great. Thanks, Matt. So at this point, I will entertain a motion to approve the minutes or have any kind of discussion around the minutes from our January meeting, if so needed.
So moved.
Second.
All right, so we have a motion. I'm going to vote aye on the minutes, and I'm going to turn it over to Andrew, our General Counsel, to take a vote.
Thank you, Madam Chair. You're an affirmative vote. Vice Chair Kaplan.
Aye.
Undersecretary Hornby.
I was not here, so abstain.
Designee Butler.
Aye.
Commissioner Shabbat.
Aye.
Commissioner Chapdelaine.
Aye.
Commissioner Choate.
Aye.
Commissioner Kleinard.
Aye.
Commissioner Davis.
Aye.
Commissioner Edmonds.
Aye.
Commissioner Gentile.
I'll abstain.
Okay. I don't know that Commissioner Garand is with us. Commissioner Murphy Rodriguez.
Yes.
Commissioner Sinenko.
Yes.
And Commissioner Sullivan.
Yes.
Commissioner McEnany, if you've joined us. I think I've got everyone. The motion passes.
Thank you, Andrew. So at this point, let's keep moving.
All right, so move on to the executive director's report. I'll do it in slightly different order today, so we can leave it on this slide before I get to the calendar, provide a few updates from the written report. In the human resources area, I want to note that we've had a lot of staff training underway as we prepare for our all-important annual enrollment, and as we also prepare to roll out some new functionality to our internal GIC systems. As we modernize our systems, we've talked about this a good deal over the last several years. We're moving away from manual paper-based work for our teams, which gives them more bandwidth to devote to assisting our members one-on-one. So this is a really encouraging ongoing migration for us. And with these changes, we want to make sure that we're supporting and training our operations staff in new ways and in the use of new tools. The training that we highlight in the executive director's report, the written one, is one of many in the works, and is designed to help staff build telephone customer service skills, and in particular, give them tools for dealing with kind of challenging callers. As we can all appreciate, some of those calls can be challenging around when it comes to insurance coverage, and it really affects their lives. So we want to make sure that our staff have those skills. Funding for this training was secured with the help of our colleagues at NAGE, so I want to thank them for that. This training will be followed by others that relate to the MyGIC Link member portal, and new phone features that we're integrating into our Magic system. We look forward to updating you more about those at a future meeting. So there's a lot going on the operations side, just to make sure we're ready to go for a busy annual enrollment year. On the communications side, you'll recall that in our last meeting in January, we had our Chief of Staff, Emily Williams, who provided an overview of our continued engagement with our members leading up to annual enrollment, with an emphasis on the need to communicate effectively to our members about the changes coming this year. Knowing the Commission's interest, we provided a pretty significant amount of detail in the written report about those efforts, which are ongoing, and we'll be coming back to you with updates as they develop. I won't go through all the details of the report, but simply note that we are using a wide variety of communications channels, direct mail, direct email, from us at the GIC, but also from our carriers. Some of those are focused on kind of targeted communications for members who will be experiencing either a change to their plan or a change to their PBM. We're also using our social media channels, our member portal, the GIC website, and as we've talked about here several times, collaborating with our colleagues in labor and HRD, Human Resources Division, as well as mass retirees. So there's a lot happening in this space, and we are also, of course, planning towards our annual enrollment virtual sessions coming in March. I do want to specifically thank mass retirees who hosted a teletown hall the day after our January commission meeting. This was a fantastic opportunity for us to walk through the changes this year, field questions directly from members who dialed in from all across the country. And I think it's a sign of the degree to which our members are tuned in to the work that's happening at the GIC this year, that we smashed the record for retirees calling into these teletown halls. We had over 6,500 retiree members call in and interact with us. So really successful effort. So thank you, mass retirees. Lastly, I want to inform you that, well, actually we informed you at the January meeting that we were participating in the Mass Municipal Association's annual meeting and trade show, part of our ongoing municipal outreach strategy. This was a very successful event. The GIC's table was very busy throughout the 2 days of the event. And this gave the GIC team, including myself, a chance to interact with a wide variety of municipal leaders and staff, both those that are in the GIC today and those who may join us in the future. So I want to thank Mike Berry, Janine Dewar, and Emily Williams from the GIC staff who spent part of their weekend there, and Maureen Quinn for assisting in setup and preparation. And just a quick thanks to A&F Secretary Gorkowitz for stopping by to say hello and to cheer us on. And finally, before we move on to the calendar, I just want to note I didn't include an update on the preparations for the annual enrollment that's upcoming, but just wanted to let you know that there's a tremendous amount of complex work that's happening at the GIC. This is an enterprise-wide effort involving pretty much every GIC unit. And, you know, this is the time really when all the decisions, the key decisions that we've made over the last few months and in the coming few weeks, most specifically around procurement, plan design, and rates, we are laser focused on getting this right and understand that effective execution is critical to make sure that we have a smooth enrollment and transition to new coverage. At the same time, there is always a significant amount of work ongoing on our other high priorities, including health equity, behavioral health, affordability, our modernization efforts that I referred to, some really exciting work around our data analytics capabilities, and many other areas. So we are eager to come back to you with updates in these areas as soon as we are able. So I'm happy to take questions there, or we could move on to the calendar and do a review and then take questions, whatever you would like to do, Madam Chair.
I don't see any questions. And I would like to keep us moving, so let's keep going. But you know, if there are questions, don't hesitate to raise your hand.
Great. We can move on to the calendar. As we always do this time of year, we have a very short turnaround between today's meeting and our next meeting on March 2nd, where we will present FY24 rates for the commission vote. This will be really the key final step that clears the way for us to begin full implementation of all of our communications efforts with members around annual enrollment. Reminder that annual enrollment begins on April 5th. I also want to note that as we've done in the past, as you can see here, we do not plan on having a commission meeting in April. I think that's especially important for this year as we make that final push to annual enrollment. We are continuing to update the calendar for the spring months. So this will look, this slide will look a bit different with more detail at our next meeting in 2 weeks. And we look forward to sharing more details about that. But in May, we will, as you see here, present our trust funds for a vote as we always do. You will also hear from our data analytics team with a presentation on our annual out-of-pocket report. And then in June, there will be a report on how annual enrollment went, a variety of statistics and data. And as we did last year, we will also take that opportunity to review progress on our modernization efforts with a focus on the MyGIC Link member portal implementation, which is reaching some really exciting and encouraging milestones in the months ahead. So look forward to those meetings through the remainder of the fiscal year and planning for the fall. Happy to take any questions on the report or the calendar.
I don't see any. Let's keep moving.
I see Bobby has a question.
Beat me to it, Bobby. There you
Yes,
go.
well, it's not really a question. It's really just a comment. When I look at the calendar, I am reminded that we will be voting on the design today, but it won't be until our next meeting that we vote on the rates. And it always seems to me and particularly now that we're going into a new procurement period for the next few years, that it seems to me that it's like purchasing a car with all the, new features, and you bring it home and you find out a month later that it's completely unaffordable. Like no one would buy anything without knowing what the cost is. So I have to comment, I don't know if this is the right time, but it just popped out at me at the calendar that it's backwards. I know I've said this probably a dozen times, but to vote on the design and then to vote on the premiums is just, it makes no sense to me. There's no logic to that. I want to say that, but I also want to commend the commission and the staff for all the great work, the new technology and the My GIC link and the outreach that you have done, I think is outstanding. I will say that, which has nothing to do with this, dilemma that we have constantly. But I do want to commend everybody on the GIC staff. You've all done amazing work under your direction, Matt. So I certainly appreciate that. And thank you for the shout out for the training, because it's huge, that at least I see that our members are taking advantage of it. And because we have really good training offers this year for everyone. So thank you for that. And I'm very much interested in finding out what you've learned from the listening sessions, and very curious about the attendance and the questions that people have asked. So anyway, thanks. That's all I have to say at this moment.
Well, thank you, Bobby. I see that Toby has his hand up.
Yes, I'd just like to second everything Bobby says, both on the insanity of this approach, which I know is not deliberate, but also of how we go and buy healthcare. But maybe that's why healthcare goes up so much. It's everything is backwards. But and also the work of the staff, which I know is great. And then also I'd request of the chair, maybe when things calm down after the rates next, and after the time, and after the the annual enrollment period, maybe we could have a conversation about the process, even though I think we've had it before, and I know there's some procurement regulations that box us in, but it would be worth it to talk about it a little bit after the season, so to speak.
Yeah, Toby, I am in full agreement on trying to find a better way. And I know our colleagues and partners at WTW might be able to suggest some innovation. So I think it's worthwhile to investigate. And maybe we can ask Matt to consider it for the September meeting, if it's not too much of a short time frame to discuss.
Yeah, thank you, Madam Chair, Commissioner Choate, Commissioner Vice Chair Kaplan. We've heard this loud and clear from the commission. Bobby, you and I have talked about it, and we certainly are open to different ways that we can do this to meet the needs of the commission. We need to be able to figure out a way to do it and meet all of our timelines. I think that is the key challenge for us. It's a great deal more complex for us at the GIC, working with a number of different vendors and different plan designs when you compare that to what the process that a municipality that's not part of the GIC would go through. So there are some unique challenges to the way we go through this process, but we are certainly open to and willing to discuss some different ways of doing this.
Great.
Thank you.
All right, we can keep moving.
All right, so this brings us to agenda item 3, and I will turn it over to Emily Williams to report on an update on the annual public information sessions, which we held last month. Emily.
Thanks, Matt, and good morning, commissioners. So last month, I presented to you ahead of our annual public information sessions. And again, the purpose of these sessions is to present the plan design and projected aggregate rates to the members so that we can receive feedback before turning to you here for your vote. The sessions were an all hands on deck effort from the GIC team, and I want to acknowledge a number of our staff who contributed to making these sessions run smoothly. Our communications manager, Leslie Monteiro, who was crucial in getting the word out to members about the sessions and ensuring that the technology and presentation ran smoothly. Additionally, I want to acknowledge Paul Murphy, Donna Wortman, Jim Russ, Cameron McBean, Janine Dewar, Aunt Margaret Anschutz, Andrew Stern, Mike Berry, and Maureen Quinn for their contributions during each session. In addition to the preparation, they were all actively answering member questions during live using the chat function during each session. And they also provided support to the executive director by verbally answering specific questions during the sessions. So today I'll be reviewing the outcome of the sessions with you. If we can move to the next slide. Thank you. So here you can see some information about the sessions by the numbers. Across all 3 sessions, we had 2,561 members register and 1,719 members attend. Throughout the 3 sessions, those members asked 718 questions and comments. We also had several commissioners present at all 3 sessions, and we want to thank you for attending as well. We really appreciate your attendance and show of support. You can see that the sessions were held at various times and dates to try to provide a few options for members' personal schedules. I provided the numbers of both registrants and attendees here so that you can get an idea of which sessions received the highest level of engagement. And the last time we held in-person public information sessions was in 2020, prior to the pandemic closing down everything. And the average attendance at those sessions was less than 40 members per session. As you can see by the numbers here, we are excited that we're able to make these sessions more accessible to members by holding them virtually. We were able to reach more members during a single virtual session than we were across all 6 in-person sessions in 2020. If we can move to the next slide. Thank you. So here are some additional ways that we were able to enhance the member experience by holding these sessions virtually. Each session had closed captioning, and the 3rd session had ASL interpreters present. All of the sessions were recorded and made available on the GIC YouTube channel so that members could view them at their own convenience. The presentation deck was posted to the GIC's website, mass.gov/GIC, before the session so that members could follow in real time. And we compiled a document of the most frequently asked questions, removing any duplicate questions or those that included personal information. And that document is posted to the website and will continue to be updated after we hold our annual enrollment information sessions in March. And after the sessions concluded, an email was sent to members to share all of these resources with them. I also shared that email with the commission ahead of today's meeting so that you would have those resources as well. And Vice Chair Kaplan, I think I see you have your hand up. Do you have a question right now?
No, actually, I think it's
Sorry.
amazing. I'm delighted about the number of attendees. I think it's terrific. And I'm very curious what the primary questions were and concerns. So thanks. I'm a little premature. Sorry about that.
Oh, no problem. Commissioner Edmonds, I see you have your hand up as well.
Yeah, thank you. I was just curious that you say you've reached more registrants virtually. Do you have any demographic data that would give us a sense about who may have been included or who may have been excluded? Or in other words, are there challenges that are associated with registration through a virtual mechanism that you've identified?
Yes, I would be happy to, especially as we work with the same system moving forward for the annual enrollment information sessions to speak with our communications manager about that. Right now, what we receive is the names, and the email is the only information that's provided with registration. So that's the only information we have at this time. And the registration does give the members access to the link so that we don't have, surprise visitors during the sessions and whatnot. So it's linked
and
to
if I
the
could just-
Zoom function.
If I could just interject
Sorry, go ahead.
briefly. Yeah, so it's a good question, Commissioner Edmonds. And one of the things that we've done in to deal with that uncertainty is to make sure that we're using a variety of different methods. And that, I think, is where the Mass Retirees Teletown Hall was a really encouraging. The level of participation was really encouraging. So with just partnering with them has been hugely helpful. But we could certainly take back what you've raised here and see if we can glean some additional insights about access and their actual ability to participate in these sessions.
Yeah. Thanks, Jane. I am encouraged that we seem to be reaching more people through virtual, and we're doing it in a concerted effort. But let's make sure we drill into Commissioner Edmonds' question to see if we can, be sure that everyone has access to this information. So I think it's a good question.
And I think we can also, we can talk with our colleagues in labor, again, talk with mass retirees to see if they have a sense of this as well from their own ongoing communication with our members, because of course there's a tremendous amount of overlap.
All right, let's keep moving, Emily, unless there are any other questions.
Yeah, thank you for that discussion, and certainly something we can take back and see with our member information sessions and for future virtual sessions, how we can improve that process, definitely. So if we can move to the next slide. Thank you. So you can see there are some common themes that emerged during the question and answer portion of the sessions. I provided an example of some of those here. Members wanted to know about the impact of the pharmacy benefit manager changes and what it would mean for them. They wanted to know what level of involvement would be necessary from their provider or from the member to ensure a smooth transition from ESI to CVS Caremark. We were able to ensure everyone that we would continue working with both vendors to transfer data for as smooth a transition as possible. And additionally, since the CVS brand can be both found on both the pharmacy and PBM business, members were looking for clarification that they could still use non-CVS pharmacies. We were able to clarify the difference and reassure members they could continue to use the pharmacy of their choice. We had some similar questions surrounding the FSA vendor transition. Members also wanted to know about how the change to the vendor task would impact their accounts and if they would need to take any proactive steps to assist in the transition. We assured members that we're working closely with both vendors to minimize disruption during the transition and that we would continue to remain in communication with members so that they know what to expect along the way. There were also a lot of questions about whether this would impact members' commuter benefits, which are currently administered by the same vendor, Voya. We were able to clarify that commuter benefits are separate and members should reach out to the comptroller's office as they are the ones who administer those benefits. There were also many questions about the residency requirements for members who either work remotely outside of New England or travel outside of New England for extended periods of time. We clarified that your permanent address should be the one you live at for 6 months plus 1 day out of the year, and that this is the address that will determine if you're eligible for certain plans. A number of those questions also centered around dependents who live outside of New England, and we encourage members to evaluate all of their plan options if they're looking for coverage for these dependents. Members also wanted to know more about comprehensive insurance coverage, also known as CIC, asking just a number of clarifying questions about what the coverage is and what impacts the proposed changes would have. Members were generally pleased that the proposed new approach would eliminate a lot of this confusion and ensure that they are fully covered. Finally, we received many retirement-specific questions from members. Paul Murphy answered many of the general retirement questions live, and we were able to share a link to the Turning 65 video from our website with members in attendance using the chat function, which helps to clarify a lot of the questions members have around that process. In addition to these questions here, we also received a number of questions about how to register for the My GIC Link member portal, and we are happy to report that since the public information sessions, we now have over 60,000 members registered, and that number continues to climb every day. So overall, the members had a lot of clarifying questions about how the plan design changes would impact their experience and how they should evaluate their options for FY24. But we did not receive any feedback that caused us to change the recommendation we are presenting to you today from when we last met. And a lot of the thoughtful questions we received will helped us to shape our March annual enrollment sessions and our approach to those, where we will be able to address a lot of these questions more thoroughly. Pause here for any questions. Oh, Commissioner Kaplan.
Yes, thanks, Emily. I just have a question. So here are the questions. So the responses are listed where? Are they available?
So along with the presentation deck for today and the commissioner information, I attached an email that was sent to all members. And within that email is the link to the frequently asked questions where we compiled,
great.
again, removing duplicates, and some have personal information, but those include an answer that is, clear that members can follow. And we'll continue to update the frequently asked questions. I'm sure there will be many more that emerge as we continue moving towards annual enrollment.
Right. Thank you. I just wanted to, raise this. I did bring it to Matt's attention that there is some confusion, a lot of confusion, I think, regarding the pharmacy and the very either new medications in the market, which are very expensive, right? And when their physicians write scripts to the retail pharmacy, let's say CVS, right? These medications are very costly. So I've had, and I've raised them with Matt, and we try to figure out what the problem is, that prescriptions for even not, 90 days, whatever the script is written for medications, new medications to the market, particularly medications for diabetes control, are incredibly costly, the out-of-pocket, like let's say $600 or $800. And a lot of people are not aware that the script should be sent to mail order, right? To Express Scripts, and probably, to, I don't know, Caremark maybe, when instead of the retail pharmacy, because the cost of the medications, if you purchase 90 days through mail order, is much less expensive. It's more affordable than the retail pharmacy, and often the prescriptions are being denied by, let's say, CVS, because a lot of people are using CVS, the retail pharmacy, and people were being charged $600, $800 a month for these medications, when if they're sent to Express Scripts or to mail order for 90 days, the cost might be $75, let's say, a month, or $50. And there seems to be a lot of confusion about where should the prescriptions be sent, because a lot of doctors just automatically write the script for the retail pharmacy. And I think more communication is needed because more and more medications are coming on the market that are new, that I'm sure we're all aware of, that are incredibly expensive and are being denied, and people don't understand why they're being denied. And I think there is confusion about, 30-day medications versus 90-day versus, maintenance medications. And a lot of doctors are trying new medications, which are very costly, particularly if you're just going to, let's say, CVS.
Yeah, thank you, Bobby, for raising that with me over the last few days. And we will have our pharmacy team dig into those to determine what may be happening. I think what's most helpful for us is to have, a specific member's specific experience that we can sort of do a root cause, kind of dig into that. But we're happy to do that offline.
Thank you.
Absolutely. Thank you, Commissioner Kaplan. And if you move to the next slide.
Commissioner Edmonds has a hand.
I think may have just been left out.
Okay.
From our previous discussion. Thanks, no problem. So again, a lot of the questions that we received from members during the public information sessions centered around concerns about when looking at the changes, how to best evaluate their options. So we're really looking forward to the opportunity to engage again with members in our March member annual enrollment information sessions. So just a refresher, I talked about these last month, but there will be 2 for retirees and 3 for active members. They'll be using the same webinar style on Zoom. There will be the ability for members to ask questions using the chat function and receive real-time answers from GIC staff. And members will be able to register for these sessions using the same methods that we used to spread the word. And again, we'll look at expanding that and how to better utilize that process to get some more information. But members should keep an eye on their email and our website and the My GIC Link member portal in the coming weeks for the information to register for these sessions. And so we're looking forward to the opportunity to continue to engage further with members and prepare for annual enrollment.
Yeah, I don't see any other questions. I wonder if you have just a minute to outline how these sessions will work. So every member knows that there are these enrollment sessions for questions about what to pick. Is that how they'll go? And it's a Zoom link, and they'll just ask questions like, what should I pick? Or I want this versus that. Is that generally the nature of it?
So it will be similar to the public information sessions. There will be a brief presentation by GIC senior staff to walk through what the changes are again. And these are, we scheduled these at a time when the commission will have made all their votes. So today's vote and the vote on rates. So we will be able to have all of that information to walk through with members, because, a lot of the questions centered around that, and we'll be able to talk about, how the plans members might default into and some of those features if they don't shop, but also to try to give them as much information as possible so that they can feel confident in how to evaluate the options. So it'll be a brief presentation, and then yes, members will have the opportunity to ask questions again. Again, for confidentiality reasons, we will ask members not to ask too personal and level questions, not to share too much personal information. Using the Q&A function in Zoom, once it's answered, it can show to all the members. So, we do want to be mindful of that. but we'll also be able to pull questions out and answer them verbally. A lot of the questions, as you can see from the frequently asked questions, people share the same concerns and just trying to learn more about how to navigate their insurance options. So we really just want to be able to engage and help with that. And I see Commissioner Kaplan, you have a question as well or comment.
Yes, I wanted to know if there were going to be representatives from the carriers at these sessions.
We are working with the carriers. We will have them involved. We're still working with them on the level as we get the votes and learn more about the plan design and the rates, to how we will be communicating that and how they will be involved. But yes, they will be involved in the sessions at a certain degree.
Okay, will they be, so, maybe it's a little too soon to ask because I know it's not totally fleshed out, but, previously when we had, annual enrollment sessions and, pre-COVID, right, there were representatives from the carriers, right, who would be at these sessions so that people could, if they were moving within that particular plan or moving from one plan to another, would be, I guess, better able to evaluate, right? Sort of what they were going to do regarding, selecting a plan. So I was just, because there were a lot of questions that were directed to the carriers, right? And so I was just very interested in knowing whether, if they're going to be there, if questions can be directed, to them that obviously are not, let's say, personalized in some way. So I didn't know what the sort of structure was going to be. I appreciate certainly having 5 sessions. And I'm assuming that people who are, let's say, currently active employees who might be thinking about retiring, would be able to enroll in the retiree section, because a lot of people have questions about their upcoming retirements.
Yes, absolutely. And I think that you are referring back to when we would have the in-person health benefit fairs, which were a little different and are different than what we're offering now. And in place of the benefit fairs, we have had the carriers, they create presentations and that are put on our website, and it's a virtual benefit fair presentation really that lives on the GIC website, and we will continue to have the carriers do those as well. In addition to this. And so I just want to make sure that clarification is there too, that if members want to look at just a certain plan that they maybe are familiar with or want to look into more in depth, they will have that opportunity too as well. Those resources will all remain.
Yeah, and I'm sorry, go ahead, Bobby.
I just wanted to say thank you for that. That's
okay. I think the other thing, to just refer back to my executive director report that that speaks to your concern here, Bobby, is that we have so the GIC is doing all that I mentioned earlier in terms of outbound communication to our members, but an important part of the communication here is also direct communication from carriers to members, particularly those who are enrolled in a plan that is going to change. And our hope is that that outreach will prompt really one-on-one guidance from the carrier to the member as to, the changes that are coming and what their options are. Now, we can't rely solely on that because, the carrier's interest is to keep the member in their plan, but they have substantial communications capabilities here that we want to leverage as well.
Yeah, and I would encourage all those communications, and I know that is what you're doing. So I'm more reinforcing my interest in this topic. Just keep reinforcing to our constituents and members the importance of digging into the options on the My GIC portal and signing up, because the more educated our members become, the easier, or at least the allure of making it easier for them to navigate some of the challenges that Bobby talked about, understanding, how to get their medications covered in a way that's most affordable. All of the information they receive and consume, it becomes helpful for them over time to understand their benefits and what benefit works best for them in the most cost-effective manner. So I keep encouraging enrollment in My GIC and being engaged, and you call it shopping. I feel like that will help them be as knowledgeable as possible. And I know that's what you guys are doing. And Bobby, I'm sure you do the same with your constituents, and everybody who represents labor does the same.
Mm-hmm. Yeah, thank you for that, Madam Chair. That's helpful feedback. I would just, before we close on this topic, we've touched on the, Emily mentioned the reference document that has all the, not just the FAQs, but really all the Qs and all the As that we received. It'll give you a good deal of texture about what's on our members' minds. For us, it is extremely helpful to have that, as it leads us, highlights really those areas where we need to, do things a little differently, sharpen our strategies around communication and member education. So if you have the chance to scroll through that document, I think it will be really instructive for you all, as it has been for us.
All right, great. And thanks for pulling that together. Let's keep moving, unless I don't see any questions.
All right. Thank you for that discussion. Really helpful feedback. We'll now move on to our presentation on the FY24 medical plan design recommendations. Cameron will do that presentation. Before I hand it over to Cameron, I just wanted to say a few brief words. As you would expect, a lot has changed. This is just kind of high-level observations before we get into the details again. A lot has changed since our last procurement in 2018 and 2019. And with procurement and plan design, we have the opportunity to make adjustments to our product portfolio that actually meet the needs of today, fiscal year 24 and beyond. Our vendors have evolved and changed. As we all know, some have merged, Harvard Pilgrim and Tufts. One has decided to leave the GIC in this time period, Fallon. And I would also say that our vendors have evolved their own strategies in many ways, and are investing in new capabilities in trend management and care management, addressing health disparities, and a number of other areas that represent real opportunities for the GIC. At the same time, however, the healthcare marketplace has also changed a lot, and in ways that make our challenges even more difficult. Clearly, COVID and the related workforce challenges have put a tremendous strain on clinicians and hospitals and provider systems. And yet we also still see this troubling continuation of provider consolidation, increased market power that benefits a very few systems, while eroding the resilience and viability of other systems. So these are, they're strong headwinds for us, but the GIC team is confident that the steps that we've taken through procurement and the plan design changes that we recommend today position us well to continue to meet our mission for our members. And with that, as just some context, I'm happy to hand it over to Cameron to present on the recommendations.
Okay. Thank you, Matt.
Good morning.
Good morning, Cameron.
Thank you, Matt. Good morning, commissioners. Just very quickly, we can go ahead and move on to the next slide. Going to be not going into these in a great deal of detail since we did review them fairly extensively last month. Just in terms of table setting, most of our proposed changes focus on Unicare as well as the Always MGB health plan with its redesignation. So once again, as a reminder, we are seeking the Commission's approval to make adjustments to the CIC premium component within Unicare and the current basic plan, which will be renamed Total Choice, as well as the Medicare extension plan. We're simply seeking approval to wrap in that CIC premium component so that it is not separately paid for compared to all of our other plans, because these are, levels of coverage that all of our plans offer. We can move on to the next slide.
Wait,
Yes.
Cameron, can I just ask you, I just wanted to know, I see the cost impact of 18 million for the state contribution. What is the employee contribution?
That is the cost impact for the state picking up the share of the premium.
CIC, the CIC.
Yeah, so this would be a premium reduction as far as the participating members are concerned. Now, it will be offset somewhat by just the standard inflation we're seeing across all of our plans with all of our carriers, and that's just a function of market conditions. But this will be an effective premium reduction for those members who are currently in plans that cover that offer that CIC premium component.
Thank you.
You're welcome. Okay, moving on to the next slide. So once again, with some of the changes we're making to the Total Choice, formerly known as Basic Plan, one of the things we wanted to do was simplify the specialist copay structure because this plan is meant to be the most wide open in terms of network and provider choice. We're just seeking one flat specialist copay that splits the difference between the first and second tiers in the current design. Next slide, please. And then again, this is a proposal that is in line with our efforts to, have some parity amongst similar plan designs. And this is eliminating a copay differential that provided some advantages to the Unicare plans, all three of the plans available to our active population. So Community Choice Plus, as well as Basic, which will again be known as Total Choice as of fiscal 24. And so that is just simply bringing in our outpatient copays in alignment with our other plans. So it would be $150 to get a eye or gastroenterology procedure at a freestanding outpatient facility. That means one not affiliated with a hospital. And then all other outpatient copays would be $250. Next slide, please. And then this is the last proposal with regards to the Unicare family of plans. And this is simply bringing the primary care physician copays in alignment with our other plans. This impacts Plus and Community Choice. We simply want the Plus plans to mirror our other broad network plans, and for Community Choice to have one flat $20 copay. Any other questions with regards to Unicare before we move on to Always and MGB?
I don't see any, Cameron. You can keep moving.
Okay, thank you. All right, and again, this plan design change is simply a reflection of the Mass General Brigham plan, now that as their network of affiliated providers within the Mass General Brigham family has expanded. Their coverage is now going to be available throughout the state, including the Cape and Islands. And with its redesignation as a broad network plan, we're simply seeking to match the 3-tiered copay structure available on all of our other broad products, except for the total choice offered from Unicare. Any questions with regards to Always or the Mass General Brigham plan? Okay. Not seeing any, so next slide, please. So again, this chart simply illustrates the copays that will be changing, those that are highlighted in green, as well as showing what the portfolio for our active plans would be based on carriers as well as network type or geographic availability. Next slide, please. And this is our last slide before we we'll turn things over to Andrew to handle the vote. And this is just to refresh everyone's memory as to what we call our mapping exercise, or the default enrollment for anyone whose plan has changed or been eliminated as a result of the changes to our portfolio, and where those members will end up. Vice Chair Kaplan, I believe you have a question.
Well, I don't really have a question. It's more of a comment. Okay. So I just want to say that, I do, obviously many of the changes that are coming have nothing to do with GIC, right? Their market, it's the market, the mergers and the acquisitions and the name changes. We're not part of that, right? So that in itself is a huge change. And I appreciate certainly that CIC is going to be bundled in now. People will not have to be paying additional, there's no additional cost to members. That is huge. And I recognize that and I appreciate it. But I will say that some of the changes, right, in the either, the primary care, even though it's $5, right, from 15 to 20. And I think it was a very good decision to try to standardize so that we are all sort of paying the same. And I appreciate greatly that there is no change in the deductibles. The deductibles are going to remain at $500 and $1,000. I am, of course, very concerned about the out-of-pocket, because I think 5 and 10, right? 5,000 and 10,000 is a lot of money for people, right? Particularly for labor, because inflation aside, our increases are pitiful, truthfully. And the cost of eggs, right, is $10.49 for a dozen eggs, which is outrageous. I walked away from that price myself. But even though, $5 increase or $150 for a very common procedure like a colonoscopy, which granted, people don't have daily, that's still from 0 to 150 is a lot of money for some people. And some of those impacts, those small changes impact, 10,000 people. That's a lot. It's a lot of people, even though it might be $5 or $10. When our members, right, are constantly falling behind and can't keep up. I just wanted to comment that I appreciate GIC greatly, the staff, and everyone who works on these and works with the carriers. It sort of standardizing and, trying to keep the costs as low as possible. But I did want to comment that for our members, for many of our members, even that, amount, right, where you're going for an outpatient procedure and you formerly paid $0, now it's $150. That $150 is out of pocket. And many of our members are, making salaries, $40,000. And so we have a lot of single parents, a lot of people of color. And so the cost is extraordinarily high for them. And I just wanted to comment on that, even though I feel the plan design is probably the best that we could do, given all the circumstances, some of which are out of our control. But I do want the commissioners to recognize that labor, that all of us in the public sector, state employees, that our, pitiful increases, in some years there is $0, that we have fallen behind anywhere from 12 to 14%. This is before we even start with this. And so, it's really important to try to keep the prices down. And I'm very appreciative that there will be no change in the deductibles. But pharmaceutical costs are out of sight, out of pocket expenses, those caps, which I'm sure everyone knows, and I've mentioned many times. We have introduced yet another bill to try to reduce those out-of-pocket costs because they are becoming untenable for lots and lots of people. And, and the retirees who don't even get increases. I mean, that's a disgrace, nothing to do with GIC, but legislatively, I can't believe that, there were no COLAs for people, for whom they received no Social Security and their pension is it. And there were no increases other than the first, I think it's $13,000 of their pension. When the legislature themselves received, 20% increases. It's disgraceful, in my opinion. But that has nothing to do with GIC. I apologize. I sort of go on this rant all the time, but just to recognize for the commissioners who do not work in the public sector, that it's very different for us. And I appreciate, Matt, everything that you have done, since you've become, executive director. I appreciate the direction that you're taking the GIC and all that you have done to maintain costs, right? To keep them as low as possible. But I still have to say that, for many of our members, any increase is huge. That's it. That's all I have to say on the topic this time.
Yeah, thank you, Bobby. I was wondering, I don't see any other questions. I was wondering if we could just summarize. I know, Cameron, you did a nice job of taking us through plan design. If I'm hearing you, we are standardizing, harmonizing, and trying to reduce premium on, eliminating that CIC. So, to your point, Bobby, very thoughtful approach here in trying to maximize the benefits that our members are getting, while mitigating, what they'll have to pay in premium, and trying to keep the deductibles same across all the choices they have. Did I get that right, Cameron? Is there anything to add?
No, I'd say that's a fairly good articulation, Chair Sullivan. Yeah, the payments come out in premium or, out of pocket, and then the state pays its share. We do the out of pocket premium comparison or report each year, or out of cost report rather. When you look at the total cost of care, it always tracks very closely to that 80% in terms of how much the state picks up of the overall costs versus how much the members pay. And unfortunately, there's always going to be those folks who end up on the wrong side of that in any given year. But we're doing the absolute best we can to fulfill our mandate given the market conditions.
Yeah, and to Cameron's last point there, we've, over the last year or so, and we're not quite done yet, but we've used the procurement process, we've used the tools in the plan design process to get at these broad underlying trend challenges in healthcare. Thankfully, those are not our only tools. Thankfully, we have, well, thankfully, but not thankfully, but we still have a lot of work to do, right? And as I've said before, the procurement isn't the sum total of our, nor is plan design, the sum total of our tools. And, they, in my opinion, they only will get us so far in addressing the underlying costs of care. And we have to do a lot more, and we will.
Great.
And to your point, Bobby, and you and I have talked about this before, we are certainly very cognizant that our members as public employees, as part of service, certainly are not paid commensurate to those that are paid in the private sector. I think the structure of our plans, the richness of our plans reflects that, and I think that's important. We do have lower copays and deductibles and more generous plan offerings than you will find almost anywhere. And so we keep that very much in the forefront of our mind. Thank you.
Thank you, Matt. I appreciate that. And I know that we have really good health insurance. I mean, as a public sector employee myself, I am most appreciative of that. But, however, I'm not going to repeat what I've said 100 times before, but,
we have
but
more
those are
work
the
to do.
people, we do have more work to do in a lot of areas. So, but I appreciate that we are moving towards that.
All
So
right.
thank you.
Yes, let's cheer them on for keeping the work going. That is good. So anything else? Any other questions on plan design? Should we move to either discuss, ask questions further, or have a motion to approve this so that we can get a sense of rates for next meeting?
Commissioner Sullivan?
I just wanted to make one comment before we go to the vote, and that is that I wholeheartedly support the comments made by Bobby and Toby earlier, because taking a vote on plan design puts me in the situation of not really knowing the impact on my individual members, in particular those members who are the least paid among us in terms of paraprofessionals. So although I appreciate all the work that has been done and I'm going to support the plan designs, not knowing the rates really doesn't put me in a situation to fully represent my.
Thanks, Tim. And I also see, Melissa, you have your hand up.
Yeah, I just wanted to share a concern I have about the default enrollment. Might be a little bit off topic, but I don't know another time to bring it up. And it's kind of linked to the municipalities more than anywhere else. But in a lot of the municipalities, we do have different kind of contribution rates for the different plans. So I'm kind of waiting and watching closely to see what these rates are going to look like and where those default enrollments are going to be. Because if people aren't paying attention, I'm trying to encourage particularly my employees too, but they could be placed in a plan that is significantly more expensive just due to the contribution rate for that plan in the municipality, and then be stuck kind of for the year. And so if we could do maybe just some more outreach to the municipalities about the default enrollment, I think that's going to be pretty important.
Yeah.
Good point,
Just,
Melissa. Can you comment, Cameron, when you looked at the default, did you also compare premiums so that there's, yeah, go ahead.
yeah, we looked from both a plan design and premium perspective. You know, the biggest differentials, you know, because the Harvard and Tufts populations are merging in almost every case, well, in each case on the active side, the Harvard plans tended to are more expensive from a premium perspective than the Tufts plans. So, you know, each of those populations will see a little bit of regression to the middle. The, you know, Harvard folks are going to end up paying a little less than they were used to, and the Tufts membership, unfortunately, are going to end up paying more. But that's just due to the actuarial value of the plans themselves.
Does that help, Melissa?
It does. It's just something that I think we need to make employees aware of. I don't want anyone to be surprised as we're moving through the process.
All right.
Yeah. That's a good point.
Yeah, yeah, thanks for raising that, and we can take that back to make sure that we, in our messaging to municipalities specifically, flag that dynamic, which is unique to that group.
Thank you.
Commissioner Seneko, I think you have a question.
Yeah, thanks. I was just going to say it may be worth, you know, people, this question about the defaults and sort of what happens to people if they don't make any changes. I think active changes is important, and it may be worth like highlighting in some way the differences for people who are having a design change. Because if you look at this chart, you know, it's not everyone, right? And so it may be worth in sort of a communication saying something like, if you are in tough spirit, like there, you know, there's a few people who are going to experience more changes. And so calling people out so they pay attention, whereas the, you know, people who aren't really having much change, you don't need to worry quite as much about getting their attention.
That is going to be part of the communications campaign. The carriers are going to be taking the lead on that in terms of, you know, explaining to our membership what's new and different with their particular plans. And that's why we're having, you know, whichever plan is receiving those automatic or default enrollments is going to take responsibility for that outreach and communication effort.
But how are they going to, how and when are they doing that? Because we're talking about, you know, like 30,000 people who are currently in Tufts Navigator.
Yep.
It's like, how and when are the carriers going to do this? Because people don't pay attention, right? They really don't until it's too late, actually.
Yeah, we're working on the timing on that. You know, most of our communication efforts are focused on rolling out in mid-March, so in advance of the start of annual enrollment, but not so far ahead that people forget about it. You know, with the hope being that we will have multiple avenues of approach through, you know, our standard communication efforts, utilizing, you know, member emails that we have on record, the assistance of GIC coordinators, the information sessions, as well as those efforts from the plans themselves, who, you know, especially, you know, in the case of the, you know, Tufts and Harvard merged populations, they already have all those folks' addresses and information on record. So, you know, all we can do is hope people open their mail.
Well, I just want to say that I like Anna's idea of, you know, if you are currently in this plan, right? These are the cost changes, right? That you'll now be, you were paying, I don't know, $30 for your PCP. Now you're going to be paying 45, right? Like
Yep.
$15. I think it's really important because here we are taking a vote once again, on something we don't know what the premiums are going to be. And so, but we do know that there are going to be changes certainly for a lot of people. And we have to make people aware. And I do like Anna's idea very much. I wish I had thought of it. But anyway,
Well, I just want to assure commissioners, again, I'd kind of refer you back to the detailed communications plan in the executive director's report. We are leaving no tool unused that is at our disposal, including what we're talking about here, which is direct outreach to members whose plans are changing in some substantial way. So we have actually given quite a lot of thought to that, and I think it's reflected in that plan. So yeah, we've given it a lot of thought.
Well, I think it's evident for sure, very thoughtful. Any other discussion? I think it's been a great discussion, good comments. Are we ready to move to a motion?
Yep,
I believe we can move to the next slide, please.
let's move.
All right, so I'm requesting a motion for us to approve the GIC's recommendation to plan design and co-pays as presented here for open enrollment beginning July 1 here in 2024.
So moved.
So we've got Tamara.
Yes, it is.
Yes, hello, Tamara.
Aye.
Do we have a second?
Seconded.
And second by Christy Clenard. So at this point, I'm going to vote aye and turn it over to Andrew to take roll call.
Thank you, Madam Chair. Vice Chair Kaplan?
so with reservations, as I have already been on record for, I will vote yes on the plan design.
Thank you. Undersecretary Hornby?
I vote aye.
Designee Butler?
Aye.
Commissioner Shabbat?
Yes, aye.
Commissioner Chapdelaine?
Aye.
Commissioner Choate?
Aye.
Commissioner Clenard?
Aye.
Commissioner Davis?
Aye.
Commissioner Edmonds?
Aye.
Commissioner Gentile?
Yes.
Commissioner Guerrand?
Yes.
Commissioner Murphy Rodriguez?
Yes.
Commissioner Sinenko?
Yes.
And Commissioner Tim Sullivan? The vote passes unanimously.
Thank you, Andrew, and thank you to commissioners and to the staff. And we know you've got a lot of work to do between now and March 2nd. So we wish you well on that. So we can move forward.
Thank you.
Thank you, Matt. Let me just say thank you to the commission for the unanimous vote of confidence in the plan design. It means a lot to us. We've put a tremendous amount of work into this, as I've already said a few times, but I'm really, really proud of the team, as I think most or not, if not all of our commissioners understand. We have a very small but mighty team, and we rely on a small number of people to do a tremendous lift on annual enrollment and all the other things that we have going on. So I just want to thank the commission, and we're excited to move forward. With that, I'll hand it over to Jim Rust for the CFO report.
Thanks, Matt. Good morning, everyone. I'm going to give you a brief update as to where we are on budget. Next slide, please. As you're all familiar with, here's the payments by vendors through January 2023. This is the state share expenses paid to each vendor. And the next slide, please, is the employee share, enrollee share for the same accounts. This is mostly informational, as you know, but it will summarize it in the next couple of charts. Next slide, please. So here we are, budget to date. You can see that the budget shape is as expected. As you know, Catherine Moore, our budget director, spends time looking at the series of payments we make, the timing of them, and how things like pharmacy rebates will affect them. And we're pretty much on target as to the shape of the payments. Next slide, please. As you can see here, this is the same slide, as you know, except we project out the future of the year in terms of what the shape of the payments will be going forward to give you a little sense of the seasonality that we expect in the next few months. And next slide, please. And this is the last of the line graphs, as you recall. I like this one because it shows kind of the enormity of the state's budget and spending on these items. And although we're slightly under budget to date, we are tracking in totality very close to where we expect to be. And finally, the last slide. So here are the numbers that go along with that. Again, I'm going quickly and I'm happy to take questions, but I know you also have this in your packet, but we are currently 2.2% or $30 million under budget on the health and claims accounts. We are seeing from the reporting we get from the plans that there has been a return to pre-COVID levels of care for most of the plans. And as we've talked about before, and we'll talk about again, they're seeing more acute cases and a little bit more intensity of care, but that is all reflected in the budget that we put forth at the beginning of the year. So we're seeing it track pretty close to where we expected at this point. And with that, I'm happy to take any questions now or as follow-ups after the meeting if you have them.
I know historically you've broken up COVID claims. Is there any need for us to look at that? Or last meeting we talked about, the increase in these new drugs for obesity. Are we tracking anything or are you tracking anything that the commissioners should know about that's concerning on a trend perspective?
We do continue to get COVID reporting from the plans. We did stop reporting it at the beginning of this year in the commission slides. There's a lot of what I would call on the spend. It's hard to be very precise on the spend side, right? So this is weekly invoices that we pay every week. Later on, when we look in the data warehouse or no, we can look by code and by various diagnoses, but this is less accurate in that way. So if we're looking at the way the plans are reporting COVID expenses to us, it might not be apples to apples. So we've kind of taken that aside, but we still do get plenty of reporting on it from each plan as to where COVID expenses are. And there's been a lot of changes over the years as well. If we're looking year over year, where some of the spending was on testing, some of it was on vaccines, but then vaccines were covered, right? And then as more treatments came out over the years, there were more treatments that would be COVID spending. So it became difficult to make a meaningful assumption at this level, but we do look at it in terms of the data we have behind the scenes of codes and whatnot. Same with the pharmacy. We track those on separate reporting that we get from each of our PBMs, and we will come to the commission on occasion with updates there, with either financial updates or updates from the data warehouse with Margaret and her team.
Okay, great.
We're also very mindful of the impacts of the end of the federal public health emergency, which is coming up quite soon. I believe it's in May. So some of those dynamics Jim has mentioned about payment for vaccines. There are a variety of other impacts on the GIC and all health plan sponsors. And I will note that I was, by virtue of my position at the GIC, I sit as a member of the Health Connector Board, and there is a significant change coming there, where there's been a pause of redetermining people's eligibility for Mass Health Medicaid, and that will be lifted. So there's a a major effort underway there that will likely lead to a number of people coming off Medicaid and enrolling in commercial coverage. The connector, of course, is uniquely kind of impacted by that because they work very closely with Mass Health around eligibility. So there'll be a big shift, I suspect, of people moving off of Mass Health into subsidized connector coverage. But there will also be an impact on other employer-sponsored coverage. So we may see some of that. It's impossible to know how much new enrollment that we may get there, but this is a system-wide impact that relates to COVID that will have some trend and other changes coming down the pike.
All right, great. Well, we'll look forward to hearing more about that. I don't see any other questions. Thank you, Jim. Oh, Bobby, I see
Oh,
you.
Yes.
I never have enough time to see your question.
That's
Should anticipate them.
You should anticipate. So I have a question regarding behavioral health, right? Like, do we know what the spend is right now? Is that broken down like with behavioral health?
I don't
what-
have that handy.
Okay.
That is something that we do break down, that we are able to pull. I'm happy to do that. and take a
Yeah,
look.
so I would like to know what that
Mhm.
spend is on behavioral health. And also, I don't know if we have the breakdown like on substance abuse, like if that is also carved out, like, do
Mhm.
we know that also? I think it would be beneficial to us
Mhm.
to get
Sure.
that data.
We can look at pulling the data around that and present a report for sure.
All right, that'd be
Provide it to you.
terrific.
Thank
Thank
Yeah,
you.
and I would note that the Health Policy Commission and others have been doing some really good work broadly, not GIC specific, but broadly around spending trends, particularly in behavioral health. We do continue to see a rise in the utilization of mental health services and substance use services. The role of telehealth, particularly on the mental health side, continues to be very high, which I see and others see as a real positive, as an opportunity to potentially expand, if not make more accessible, those services to our members. So we always take steps to make sure that our plan design reflects that, because we want that trend to continue. So there is definitely a lot happening in behavioral health. And as I mentioned earlier, that and other topics are ones that we're eager to get back and dig into more with the commission as we get past the super busy season of the months ahead.
Right. I would also like to know what the, EAP, right? Like so what's the status? I hope is that trending upwards or, I'd like to know when you have the time, what, obviously not for the next couple of months, but, sort of how EAP is trending.
Yeah, we could certainly look into that as we have provided updates in the past. We will look for an opportunity to do that with you.
Thank you.
All right, I don't see any other questions. We can move on. Thank you, Jim. I know
Thank you all.
we cut you short when we're running behind, so glad you had a chance to show off your expertise and the good work you do. All right, I don't see any other business. I don't have any other business. So I am going to adjourn this meeting and give you all a good chunk of time back on this beautiful, beautiful spring-like day in February. So thanks for everyone's participation, and we'll see you in a few weeks. Bye-bye.
Thank you all.
Bye. Thank you.